Hello Uganda, my name is Mwanguzi Shadrack from Health Touch Uganda, and today I'm going to be addressing some of the questions which have come up, especially in this pandemic. Today we are going to focus on breastfeeding mothers, those with newborns, those who are pregnant and are expecting to have a baby in the nearby future. There are some questions which have been moving around, and today I'll be answering some of them. So there are people who ask, in communities where COVID-19 is abundant like we are, should mothers continue breastfeeding? I want to say that breastfeeding is very important, and breast milk is one of the most important things that a newborn baby needs to survive. So we have a lot of COVID-19, but as of today, there is no evidence of coronavirus being transmitted to the baby, to the breastfeeding baby, through breast milk. So whether you have been confirmed to have the disease, you shouldn't stop breastfeeding in the fear of transmitting the disease or the virus to your newborn baby or to your breastfeeding baby. Other questions: following delivery, should a baby still be immediately placed skin to skin and breastfeed if the mother is confirmed or suspected to have COVID-19? Now, in the hospital, after a mother has delivered, usually normal deliveries, we place the baby on the mother's body for that skin to skin contact. Remember, when the child is still inside or before the baby is born, the temperature of the mother helps in regulating the temperature of the baby inside the abdomen. So when the baby gets out or is produced, the baby gets exposed to the environment out, and because they are very small, they stand a risk of becoming cold, which might actually result into death. So one of the things we do even before we get something to cover the baby up is placing this baby on the mother's body. But now in the COVID-19 situation, in case the mother has a baby, someone wonders, should that continue once the baby contracts the COVID-19? And I want to say that the risk of the baby acquiring COVID and any dangers that may come as a result of that are way less comparable to the dangers that may come when this baby becomes cold. The baby can actually die. One of the causes of early death of the newborns is low body temperature. So it's very important, and we still do it, and it is okay to put the baby on the skin of the mother even when the mother has COVID-19. And one of the ways this also helps, because we want the baby to start breastfeeding as early as possible. So when the baby is placed on the mother's skin, it also quickens the step of the baby breastfeeding as early as possible. So some people ask, can women with confirmed or suspected COVID-19 breastfeed? I said yes, go ahead and breastfeed. There is a risk that the baby will catch COVID, but the dangers of not breastfeeding outweigh the dangers of catching COVID. But maybe you should be more cautious when you have COVID or you're suspected to have COVID. You should be more cautious because you want your child to be safe and not catch the COVID. So make sure before you breastfeed, you wash your hands very well with soap. If you can't access it, then use a hand rub sanitizer. If you're sneezing, make sure you sneeze in a tissue paper, and after sneezing still you wash your hands. Just do that. Clean the surfaces that you regularly touch as a mother, because the baby may touch them, and then because babies like touching and putting their hands in the mouth, but you don't want your child to touch surfaces which have been contaminated. So just clean place regularly, clean yourself before touching the baby. When you're breastfeeding, put on your mask, and you will be protecting your baby as well. So some people ask, what if I get COVID and I'm too sick, I am too weak, and I cannot even breastfeed? Remember, we said the best milk for the baby is breast milk. So if you're in a state where you can't breastfeed all by yourself, get someone who can help you squeeze out this milk. We call it expressing. Express it and put it in a clean cup or container and feed, or someone helps you feed this baby, and resume as early as you are able to. And if you are in a state where you can't even squeeze out or they can't express out, then you may resort to formula feeds or formula milk and keep the baby on this until when you are able to do it all by yourself. People are being vaccinated, so some people are wondering, can a breastfeeding woman get vaccinated against COVID? And the answer is yes. All the vaccines that are out and are being used are safe in breastfeeding women, and there is no evidence, because the vaccines that we are using or they are giving out don't contain the live viruses, so they cannot in the end be transmitted to the baby. And actually, when you are vaccinated, you develop or you produce antibodies. They are like soldiers that help you prepare your body to fight off any infection or any viral attack that you may get in the future. So these soldiers have also been seen to be present in breast milk. So it's an added advantage. When you get vaccinated, you will transfer some of those soldiers, those antibodies, to the baby, which will protect the baby against COVID-19.